This is On the Record. I'm your host, Jerome Sawyer. The country is in a state of emergency. Within a week, we have seen the number of cases of COVID-19 climb to 4. This week, we learned that case number 5 is in Grand Bahama, a game changer in so many ways. With the entire country now under a 24-hour curfew and orders for social distancing and no public gatherings, the situation is only being compounded with thousands of workers being laid off as life comes to a standstill. This week, the Prime Minister also closed the borders and made an impassioned plea to heed the warnings. Tonight, we have one of our foremost experts on infectious diseases. She's come to answer your questions and help us all understand this latest global health threat known as COVID-19, the coronavirus state of emergency, with my guest, Dr. Nikkiah Forbes. Our conversation begins on the other side of this break. So the project really pays itself.
Correct.
They set up
at the conference, more the school.
As a journalist, I always have to focus on the facts, and sometimes that means going to investigate for myself. On the Record, Thursdays at 8 p.m. right here on RTV.
This is On the Record. I'm your host, Jerome Sawyer. This week, the Minister of Health, Dr. Dwayne Sands, confirmed the 5th coronavirus case in Grand Bahama. With over 200 people already tested and a 24-hour curfew, there are also many questions. And tonight, we hope to get some answers. My guest tonight, while well known and respected by the medical community, was virtually unknown to those of us in the public. But her expertise and vast knowledge has catapulted her in many ways to almost celebrity status, although she'll differ, within the local community, who laud her and her performances and answers at the ongoing press conferences. She's the director of the National HIV/AIDS and Infectious Disease Programme within the Ministry of Health, and a favorite among Bahamians watching at home. Dr. Nikkiah Forbes, thank you so much for being here on the record with us tonight.
Thank you very much for inviting me.
Before we get into the nuts and bolts, I've got to ask you, what is it like being in the spotlight? I mean, this is what you do. This kind of work is what you do, and you've done all your career. But suddenly now, you're front and center almost every day, and I would say probably one of the most talked about people in the country now, just by virtue of the work that you're doing.
I'm just doing the work that any infectious diseases doctor is supposed to do. We're trained to manage these kinds of things and to just put our best forward. We have been trained to do so, so just doing what I should be doing.
And I got to tell you, you're doing a great job, and people love the work that you're doing, so keep it up. Let's get into the nuts and bolts of this now. This week we found out the confirmed case in Grand Bahama presented herself to health staff, but was not, correct me if any of this is incorrect, but was not tested. Is that correct? Or give us let me back that up. Can you give us again the circumstances that led to the confirmation of her case?
So my understanding is that she had symptoms, cough, and fever, and so she presented herself to the health system. So as you know, we are in influenza season and cold season, and as you also know, some of the symptoms of COVID-19 can overlap with other respiratory infections. So as I'm told by the health team in Grand Bahama, she presented to the healthcare system, and we have had an increased sensitivity for considering COVID-19 when we are seeing patients that are presenting with symptoms that are compatible, and that is cough, fever, and shortness of breath. So she would have presented to the Grand Bahama Health Services like that, and so she got tested, and her test came back as positive.
Mm-hmm. She had no travel history.
She had no significant travel history.
Mm-hmm. So you say significant. Help us understand. I said no travel, you said significant. What's the difference?
So certainly we know that the incubation period of COVID-19 is about 14 days. And so we look at whether or not a person has traveled to a place where there is high level of transmission or spread in the community in the previous 14 days before they present with symptoms.
And in her case, as well as the case with our first confirmed COVID-19 case, there was no travel history. What does that tell us immediately?
That should make us know that they would have come in contact with the virus in the community. And so that would imply that either they came in contact with somebody who did have a travel history or had been around someone else with COVID-19 who was high risk, or we could think worst case scenario that there could be transmission in the community and that persons will have cold and flu-like symptoms and that there could be transmission. That is why we have taken this very seriously and put into place measures for containment and to prevent ongoing transmission.
We think, again, we think somebody who presents with these symptoms or at this point can transmit. Can I, in this state, with no symptoms, can I transmit that to you and to others?
Yes. So definitely it's been documented that there are people who have no symptoms. We call that asymptomatic, and that they can spread the virus to others. Additionally, there are people who have very mild symptoms. They can feel stuffed up, they could just have a runny nose, and they can spread the virus, through respiratory secretions. You could blow your nose, you could rub your nose, you could sneeze, and that is definitely a way that the virus could be transmitted from one person to another.
And why is that so dangerous, particularly at this time of the year? I mean, I live with sinuses year round, but why is that such a bad thing at this time of the year?
It's a bad thing all the time when you have a virus like this, because that means that you could think that you're perfectly well. You could think, I'm just having a bad day, I'm just having a sinus issue, and go about your work as usual.
But this time of year, are we seeing people with more flu-like symptoms which are not necessarily related to this?
Yes, because we're in cold and flu season.
Right. So we're in cold and flu season, is that compounding the problem? Do you think is that making people a little more nervous and wanting to be tested?
I would say it's compounding the problem. So the answer to that question is yes. Part of the reason it's compounding the problem is when we think about this situation with this virus, how infectious it is, that we need to get control because we don't have immunity, people could have mild symptoms and think that they just have a cold or a flu. If they don't stop or curtail their usual activities, if they go about their business as usual, that means that they're putting people at risk of being exposed and increasing the chance that the virus is going to spread and that we will not be able to control the situation. Additionally, there are people who do have mild symptoms compatible with a cold or a flu, runny nose, sore throat, maybe a dry cough, that may be very, very concerned, and I understand the concern, that could be saying, let me just go to the health center, let me go to the emergency room or an urgent care to see about how I can get this test because I have to know whether or not I have COVID-19. That's very challenging in this situation because, as you know, with the virus being spread easily from one person to another, if you do go into a crowded health system, if you indeed do have COVID-19 and you're feeling reasonably well and you have no symptoms or conditions that would make you at risk to have a bad course or die, what you will do is expose people who are vulnerable. And those people will become very, very ill and they won't do well. Some of them will die and it will flood the health system too. So overall, it's not a good thing.
What is the challenge of the healthcare or those in the healthcare system now in dealing with patients who are presenting, whether they think they have it or they're presenting because they just want to be sure? So what's the challenge with that? If I walk in and I've got a runny nose, cough, I'm already fearful. What is the challenge for you as the healthcare worker, or as the system now that has to see me and decipher all of this?
That's a very good question. You ask very, very good questions. There is a challenge with that. First, let me say that if we had the ideal if we could have everything that we wanted, we would test widely. That's very, very recommended. But in the real world, we cannot have everything that we want. We just do not have everything that we want. And so when we think about persons who are presenting with symptoms and signs, for doctors, we know that if you are high risk, for example, if you are coming from a place where there is high levels of community spread, or if you've been in contact with someone who's known to have COVID-19, we will highly prioritize testing, and that would be a suspect case. Now, in the context of flu and cold season, there will be people who have some of these symptoms, fever, runny nose, cough, but they could have influenza. So the challenge is how to decipher this. There are things that we would have to do to make sure that our offices are equipped and that it's safe to see such patients and that we're giving good guidance, keeping in mind the situation and what we have the capacity to do at this time. So in general, for the practitioner, we have recommended some guidelines. Have your patients call ahead if they're having symptoms so that you can work out what's the best possible place to see these patients if they have to come to your office. And if they need a referral to another specialized center, we can also work that out. So we can organize to see the patients safely and put them in the necessary isolation rooms. That gets very important. However, this really, really needs to be communicated widely because patients also have to understand what should they do if they're having symptoms. Mm-hmm. How do I go about seeing my doctor? Who can I call? There are hotlines that can help to guide. How can I get seen? And how can I get tested? So that's part of the things that we have tried to continue to communicate with persons in the community and with private practices. Overall, our institutions have plans where we made plans to get ready for COVID-19. We knew we would eventually see a case, so we've really, really had to prioritize and streamline and determine in our institutions where we can safely see such patients, where we can work up such patients, and we've had to prioritize because if you don't have 1 million tests, and no country right now has 1 million tests, you will therefore need to use best practice guidelines to test persons that are highly suspect and to prioritize tests for people who are sickest and have immunocompromising conditions. In regular English, that means they have other medical problems that could put them at risk for not doing well with this or having a bad outcome. That is really what we're having to do right now, and we know that we want to be testing wider.
People are calling for rapid and mass testing, and we need more test kits. We heard the minister give us the amount that are on, and I think we're moving to about 10,000. We're hoping to get in. That's the number he gave. Why can't we move to that stage, or why should not we move to that stage now?
We have very, very good persons that know laboratory science on our team. Their names are Dr. Indira Martin and Dr. Jessica Edwards, and I want to thank them for all the hard work they're doing. They're really burning the candle at both ends, trying to get out testing, and we've accelerated rapidly. When you talk about the rapid test, my understanding, they have told me that they have some concerns because when we do tests for any condition, we want to know certain things about the test. That it is going to do what it says it's going to do. That it's going to correctly identify and diagnose persons with a condition, that it won't give us false results, whether that's false positive results or false negative results. And there are ways that scientists ensure that that will happen with new tests. And so we need to follow the best practice guidelines for which tests can be approved and work, and we need to make sure that it works in country. Now, that's a lot of scientific information, but at the end of the day, we need to make sure that if we're using this testing modality, that it is going to correctly identify patients and that it won't give false negative results. What that means is if someone has COVID-19 and we use one of these tests, if they test negative, but they really have the disease, that has implications.
That's huge implications because now they think they can go out and live their lives normally.
Yes, and so as I understand it, and I don't want to speak outside of my area, the lab scientists are ensuring that our tests are the best quality and will do what they're said to do. That takes some time.
I want to talk a little bit about the contact tracing and how it works. We saw it here in New Providence with the first case, and how people were identified. More cases came, and we saw the number of people who were tested. If you could sort of take us to the Grand Bahama scenario, if you can, and what is or should be happening there now that they've reported their first case.
So whenever you have an infectious disease that is easily transmittable, there are things that are done. One of those is contact tracing. What that means is that persons who have come in close contact, prolonged contact, their names will be asked for from the person who has the infection. And then the public health team, the surveillance team, will go out and reach those persons. They will ask them questions about whether or not they're having any symptoms that are compatible with the infection. And they will also be doing testing on those persons. And so that is absolutely happening very well since we've established our first case. We have been in touch with the contacts of these persons. It does take time, so let me take you back to the Sunday when we announced our first case. We found that result out in the wee hours of the morning. So as you know, you couldn't knock on somebody's door. It is a very organized process whereby you get those names and reach those persons.
And you don't want to incite panic either.
No,
I think, yeah.
Absolutely. So I have to say the surveillance team, they're doing an amazing job. They're very good at what they do, and you couldn't just go in and swab somebody. You have to, there will be questions. You would have to talk with them, allay their concerns, make plans to follow up with them. So that's definitely being done.
In anticipation of this show, we have asked some of our followers and our viewers to submit questions. I want to bring to you a question from one of our followers online. Can a cured COVID-19 person be reinfected once they return to their environment? And are they able to transmit the virus to others if they do make a full recovery?
So that question, that's being looked at in the scientific community right now. The first part of the question, that is, in terms of whether or not someone could get reinfected. That's somewhat controversial because there had been some reports that persons who had the COVID-19, their repeat tests were negative, but then they became positive again a few days or within a week or so after they were tested, which gave rise to the idea that you could be reinfected. So scientists think that that doesn't happen. We think that that is part of the same infection, and there could be some shedding intermittently of viral particles. So whether or not someone is infectious, well, what we know is that there's a definition for it. Has someone recovered from COVID-19? So that definition is one, based on lab testing, and that is you have a repeat test within basically your symptoms would have been improved, and the repeat tests, there should be 2 tests, and they should be taken 24 hours or more apart. And if they are negative, that person is said to be recovered, and therefore they should not be infectious. So we are in the process of organizing those tests.
In the case of the first confirmed case, at the last press conference, we learned that she was scheduled to be released from hospital. Without getting into too many details of sort of her personal life. But in a situation like that where someone has been hospitalized, who is diagnosed, what then happens once she is released from hospital or from constant medical care? What happens to her, and what are the protocols relative to her recovery?
So with all of our patients, if they are well enough to go home, we may make the decision that they could have home care, which is within some practice guidelines. But I've been in touch with her by telemedicine. So we're still making sure that she's doing well.
And how's she doing, by the way?
She's doing well.
She's doing well. Good. That's good news. And the 4 others, how are they doing as well as the Grand Bahama?
So certainly their symptoms are better. The Grand Bahama case we just recently announced had come to the healthcare system, so she's still under treatment.
Okay. Another online question. What kind of treatment is given to persons who test positive for COVID-19 with both severe and mild symptoms?
So there is a lot in this social media spaces and on TV about treatment options for COVID-19. And we've heard some of them. Some of them are antiviral agents. Some of them are medications that are used for other conditions. At this time...
And even miracle drugs I've heard of.
Yes, you're right.
Yeah.
At this time, both the Centers for Disease Control in the United States and the World Health Organization have recommendations for treatment, and that is usual supportive care. Fever reducers, acetaminophen or Panadol is a good example of what could be used. If you're having mild symptoms, comfort care, the same things you would take if you had a cold or flu, cough syrups, fever reducers, self-care, eating well, drinking a lot of fluids, sore throat drops, that will help you to feel better. And if you have a good intact immune system, your body will take care of it and you should be fine. For hospitalized patients, we rely on a lot of those things as well. And for people who are having problems breathing, we will give them oxygen and help to make it easier to breathe, essentially. When it comes down to any of those medications, and there have been about 5 that have been proposed to be used for the treatment of COVID-19. As a matter of fact, Mr. Sawyer, they're in randomized control trials right now. What that tells doctors is, will this really work to make the patient better? Without a shadow of a doubt, taking into account other factors, we've removed those so that it's standardizable across the board for all patients in all institutions. I hope that wasn't too complicated. So there are 5 medicines that people are considering using. There's interferon, there is Tamiflu, that's a flu medication, also Tamivir. There's an investigational drug by Gilead Sciences called remdesivir. There is chloroquine and hydroxychloroquine being proposed to be used at this time, and another medication an antiviral medication that we use in HIV patients. The truth of the matter is, and I'm going to try and make this as easy to understand as possible, scientists want to know the answer to that question. There are some small trials that are going on, but they're not the best quality evidence. They may use it in a few patients, but it's not absolutely the best quality evidence to see if this can work. So we're trying to put it together now to see if these agents can be useful. We have to use caution. Let me tell you why. These medicines, in theory, could work against some viruses when we know the science based on our textbooks. But how will it work in the human body in someone who actually has the infection? Will it make them better, or will it make them sicker, and will they die? So some of those same antiviral drugs, as a matter of fact, had been used in other viral outbreaks, like Zika and chikungunya, for example. And some of them made the patient worse. They made them sicker longer. They made them shed virus longer. That means they're more infectious. And they drew out the course of the disease. So we have to be very, very careful when we start irresponsibly using medicines. There are side effects of these medications, and they can make your patient worse. And there are reports of that happening from the medical community, that they're having terrible side effects of these drugs. In fact, one man, as you know, swallowed some chloroquine and died. And there have been other reports of people who are having chloroquine overdoses. And so I would say use caution. They are not recommended for that reason at this time. And so I want to caution those healthcare providers who are also prescribing this off-label, outside of the usual indication that you could do your patient harm. I urge you not to do that. And we know how we should and shouldn't be.
Oh, we've got to go to a break. I just got to ask this very quick, yes or no. We're people, we depend highly on Cerecy and all those kind of bush teas. Yes or no?
So remember, they can have side effects.
Okay.
And
okay,
yeah, no.
Good answer. All right, stay with us. We're going to be back with more with Dr. Nikkiah Forbes right after this. Hello and welcome to On the Record, and the balanced, true and open debate you've been looking for.
This portion of On the Record brought to you by Executive Printers of the Bahamas Limited. We print profits for you.
And we are back. This is On the Record. This segment is brought to you by Executive Printers. While the world continues to grapple with the spread of coronavirus, COVID-19 pandemic, local medical experts tell us that the 5 cases are the proverbial calm before the storm, as a surge of cases is yet to come. One of those experts is my guest tonight, Dr. Nikkiah Forbes, Director of the National HIV/AIDS and Infectious Disease Programme within the Ministry of Health. I want to talk about that statement and the surge. I call it the proverbial calm before the storm. I think because we've only had 5 cases up to this point, some people may think we're out of the woods and it's okay, or it's not as bad as you all may predict, or it can't be as bad as what's happening in other parts of the world, when in some countries you've got 700 plus people dying a day. What do you, I know we've addressed it in the press conferences, but how do you address that now to people? What do you say to them when they say, oh, we've only got 5 cases?
So remember what we know about this infection. 80% of people will have mild symptoms. 15% of people, they'll be feeling a little worse. They could have high fever, they could have difficulty breathing at certain times, and then 5% of persons will be sicker than that and will really, really need support for their breathing. So anybody realizing that should know that those are 5 cases that came forward with symptoms that were compatible and were tested. So certainly other persons could have COVID-19. And it behooves us to know that information and to do things to stop and slow spread, stop or slow transmission is what us ID doctors call it. Mm-hmm. So that's what we're doing. It's no accident that it's 14 days in most countries that the restriction of movement is put in place. Mm-hmm. Because what that does is it slows down new infections, and it allows us an opportunity to see who's presenting to the healthcare system and what the virus is doing. So if you're asking me about the question about a surge, yeah, that's one term, but what we're talking about is a sudden, rapid increase in cases above where the health system can manage. It would put us under pressure that we couldn't manage. We couldn't manage all those persons. Therefore, people would not get the care they need, and people will die. That's what's happening in some of those other locations. Mm-hmm. We are needing to see on an everyday basis, more than once a day, constantly, what is happening in the health system in terms of people who are sick and presenting, so that we can have a better idea of what's happening. And we have to prepare for the worst case scenario, which is a sudden increase of cases or a surge. What does that mean? Doctors and health systems need to be prepared to identify beds, make beds available, make staff available, testing, and support for those persons. Did that answer your question?
Oh, yeah,
okay.
Definitely. Now, the Attorney General on Tuesday in an interview with Our News said the medical experts are pushing for a 30-day extension and are now warning there will soon be an update on cases as a result. A resolution is going to be tabled in the House of Assembly that looks at extending this period of time we're under the lockdown. What are the indicators that, from a medical perspective, that we are going to be in this state longer than month end, as government would have announced?
So there's a doctor that is well respected in the infectious diseases community. His name is Dr. Anthony Fauci. He's the one advising the U.S. government on the infectious diseases aspects of this pandemic. So he said it best when he said, you don't decide the timeline, the virus decides the timeline. That means that you have to see how many new cases you're getting, how much transmission you're getting, details about the transmission in country. Is it person to person? Do you have a cluster? Do you have it under control? And how many people are sick and presenting to the healthcare system in real terms, and how are we meeting that capacity? All of those things have to be taken into account when we think about things like restricting movements. Restricting movements simply slow down transmission of virus and new infections. But there are other things that you have to do while that is happening. It is not the only answer to solving the problem. We all have to do what we're supposed to be doing on a personal level, practicing the prevention strategies, hand washing, keeping physical distance. I like we're physically distant.
Yes.
Coughing.
We made sure that we had the right distance, yeah.
Yes. Coughing, washing hands, how you cough, staying home if you're sick, all of those things that have to be done. I couldn't speak to the governmental side of things.
Sure,
I am
sure.
just a technical person, but the virus and what is happening in your country decides the timeline.
You used a term that I want you to explain, under control. What is under control? You look at the United States, you look at, Italy, you look at these other countries that have more advanced health care, that have more money, larger populations, and they seemingly are not under control. What is under control?
Well, let me try and explain it in regular English. When you have an outbreak, that means that you have a disease. In this case, you've never had it before. Even one case is considered an outbreak. So we're in an outbreak. Scientists plot something, it's called an outbreak curve. That simply means how many infections you're getting over time. And when you saw, maybe you've seen graphs on TV about the surge picture, it's a sudden sharp increase and then it goes down. But it's a graph where you're looking at where do cases start to go down. And when they are down, are they within the capacity of your healthcare system, and has transmission even slowed or stopped? That is some of the things that we would be wanting to know. As you say that, I find it interesting because, well, two thoughts. One, before the virus got to you, in your country, as a whole, we knew it was coming. That there were plans that should have been put in place. They were put in place in the Bahamas. And it's what you do. It's very important what you do at the first sign of trouble. I want to expand on that a little more if afterward, if you give me the chance.
Please go right ahead.
I don't want to answer it just now in this point, but when we think about under control, so China, they did a remarkable job of getting this under control. So did many other countries like Singapore and South Korea. So where they are seeing few cases, in some locations they are having no new cases per day, and deaths have stopped. That is wonderful. But even they are saying with travelers and persons returning to those locations, they are thinking that they will have a second wave of infections, and they're having to plan for that. So let us please keep in mind that this is something that's changing every day. This is moving and dynamic.
You said at the first sign of trouble, the Bahamas responded. What did we do right? What did we do to this response that we should have done?
From the beginning, when there was just a cluster of cases in China, we knew. We had an alert, and we watched this through international mechanisms. At the time that the Chinese government announced that they have this cluster of pneumonia cases, that was December 31st. We were aware of that. We always have emergency plans for outbreak infections, some of those being viruses. When the World Health Organization said that this was a public health emergency of international concern, the day before we had already had our draft plans that we had adapted. We had been working on it all up to that time, and we had made a draft for our health system. I'm a consultant at the Princess Margaret Hospital. We had a plan that was preliminary, that we had agreed to across our various specialty sectors. when the WHO does something like say that something is a public health emergency of international concern, that provides support for countries, but it's also a notice to countries that you now have to have a specific plan for this new threat. So we did amend our plans for this specific threat, and we diligently went about preparing for what we knew was coming. We did not have everything that we wanted. We're also constrained in some ways, but I can thank my colleagues at the Princess Margaret Hospital, especially the leadership there and the doctors and the head of department in the Accident and Emergency Department, the medical chief of staff, all the consultants and the leadership there in giving us support for helping us to enable help to the Bahamian public should someone become ill. We didn't have the perfect ideal situation, but we had something that we could retrofit to offer care in the safest way possible. And we continue to strive every day to get it better and better, and it's a good work across partnerships. There is something else that I want to talk about. Oh, and the other thing is that it is not just a health response. It's a multi-sectoral response at all levels of government and leadership across parties. But I'm not a politician, but I think that it's a good example of what we can achieve when we work together. So
well said. And I'm very happy you gave kudos to PMH folks, and that's very important. Princess Margaret Hospital got it right. We're always criticizing the hospital, but we got it right. I've got to ask you this too before we go to a break. Several people have said to me, and I'm wondering whether this is a possibility, and I know it for a fact, that there were people at the beginning of the year who said, oh my God, I just had this really, really bad flu. This was nothing that I've ever experienced before. People were in bed for 10 days. They were out sick for 2 weeks. Is it possible, or is there a possibility that people may have contracted this previously and just thought it was a really bad flu and wrote it out? Could that have happened? Because a lot of people say to me, Jerome, I think this has been here before. I think, I have a family member or a friend, hey, I think I may even have had it. People have said that to me. Is that a possibility?
So I'm a little bit of a nerd, I don't mind saying so. But you know what? When I was looking at the timeline of this last night, the government of China came out on December 31st and said that they alerted us, they have this problem, and they have identified a new virus. You remember that there were whistleblower doctors. I applaud people who have the courage to tell the truth, because the truth is inconvenient. And they came out and said that there was a problem, and they were penalized highly for that. So remember, there was still global travel going on before we restricted travel and before there was a reduction in travel.
And people travel a lot during the holidays as well.
Absolutely. So then when you look at the first case in the United States, that was exactly 15 days later in Seattle. That's the longest incubation period of the virus. So I don't want to speak outside my lane. I'm just a doctor, but that implies that, that implies that persons had traveled. And so it's not impossible that this virus could have traveled by people on airplanes to other places. That's certainly not impossible. But I do want to say that the question had been raised in China about whether or not the COVID-19 was around before December. So they went back and they looked at their flu samples in the month of November and checked it out to see if any of those actually had the SARS coronavirus 2. That's the virus name for this thing that causes this infection. And those were negative. So I think reasonably we can extrapolate that in December is when this became a problem and that people could travel. But we have no clear data to say yes or no to that at this time. But I couldn't discard it and say it's absolutely impossible.
Good answer. With that, we are going to take our break, another break in the show. This is by far one of the best discussions I've ever had on the show. I'm sure you're enjoying it at home. Stay with us. You're watching On the Record. We'll be back right after this.
Matt, where in the world is Matt Lauer? Where in the world is Alison Greenslade? And so it's about the low value of cottage in Atlanta. So we can talk about it.
On the record tonight, the government's purchase of the Grand Boucan is a hot subject in the news. host, Jerome Sawyer. At a news conference this week, the Minister of Health said, "We do not have the option of failing here. We do not want to be found wanting. We will not be found wanting." My guest tonight is the Director of the National HIV/AIDS and Infectious Disease Programme within the Ministry of Health, Dr. Nikkiah Forbes. As we went into the break, we were talking about this issue of the response, and something we discussed just a little bit during the break, but a lot of people are saying, why didn't we close the borders earlier? Why didn't we shut down? If we knew of this health crisis, why didn't we move faster to isolate ourselves?
I've been hearing that a lot. That doesn't work in a pandemic. It doesn't. Scientists have looked at if you could separate sick people from well people. There have been models of that. So if you have over 180 countries with the virus, and if you have the movement of people, well, what that means is that for you to effectively stop having an infection in your country, you have to not have any local people ever travel out again, and you have to have no visitors ever come to you ever again, including returning residents and Bahamians. They couldn't come back from these locations. We know that's impossible. So isn't that impossible? You can just seal yourself off in a bubble and never travel again and shut down forever. So you know in an outbreak, in a pandemic, you're eventually going to have a case. So it gets very important for you to be able to detect that case early and put in place steps and prepare and plan for it. That's the reason why you can't just say, okay, stop all travel, no one in and out from December 31st. That's what we would have had to do.
Yeah, interesting. Gonna go to some online questions now. This one here saying there's been a lot of news going around about the virus having a long period of time. It can remain airborne, or asking, I guess, can this virus remain airborne? Under what conditions?
Yes, we talked about this in a press conference, and I heard people were still confused afterward. The virus can only go airborne if we do medical procedures to make it airborne. On a regular, everyday basis, people who have COVID-19 in the community, even in hospitals and health centers, who do not have tubes in their breathing pipe, for example, will not be able to breathe out virus particles that can float in the air and hang in the air for long periods of time. That is what it means when something is airborne. It means that there are tiny particles that can float in a little cloud for up to 3 hours. That can happen in special situations related to this infection. If doctors or nurses do certain procedures, like put a tube down into someone's airways, or if we do procedures where we're deep in the lungs and the airways using special equipment, if we are doing things that are in the person's lungs, like deep suctioning, that is what causes the viral particles to get smaller and be able to float in the air for up to 3 hours. That is why healthcare workers use special equipment to be able to safely provide care should we have to do that for a patient. In the everyday context, with somebody not having a tube down or any special procedure, this virus will not be in the air.
Thank you. Let's move on.
That was clear?
I hope they got it now. I hope they got it now.
Okay. All
Cannot. Again, another online question. Are mosquitoes able to transmit the virus?
No, not that we're aware of.
Okay. How long do you think we will have to keep social distancing? Again, another online question.
The virus decides that. The virus decides the timeline.
Why is it seemingly not affecting children?
We don't really know. So it had been proposed that, well, this is a coronavirus. We all know what that is by now. This is a kind of coronavirus. There are other kinds of coronaviruses that cause cold symptoms. Someone scientists postulate that children, because when they go to daycare, they're with other children, that they maybe are more exposed to coronaviruses and are therefore a little more resilient. But we don't really know the answer as to why children have a milder course.
But children are able to transmit.
Oh yes, definitely. That's why children need to be home right now. That's why schools are closed.
And
yes.
you shouldn't have play dates and things of those
No.
nature. Okay. Here's another online question. Regarding beach closures, is there any validity that salt water at the beach can help with the healing or clearing the bacteria virus away?
No.
Okay. So don't go to the sea to cleanse yourself. Another online question. Have any local healthcare workers been exposed to the virus as a result of providing care to patients? If so, are any of them quarantined or in isolation?
So healthcare workers would be high risk in providing care for such patients. We put on equipment to help to prevent our exposure to such a virus. However, there are times in healthcare systems where you can be exposed before the diagnosis is made. And therefore, there would be special measures put into place to follow those healthcare workers to see if they're having signs and symptoms. And out of caution, we would put those healthcare workers in quarantine for the long incubation period of the virus, which is 14 days. And we have had to do that.
You have had to do that.
Yes.
Some healthcare workers, have any of them tested positive at this point?
Not as far as I know.
But they have been in quarantine.
Yes, that is what best public health guidelines would say you should do, and we always follow those.
What is the lifespan of the coronavirus on different surfaces? Again, another online question.
I've been seeing that. So it can be on surfaces. So it can live on your hands. It can live on gloves for up to, that's plastic, right? So it can be up to 8 hours, sometimes days.
We'll talk about gloves
yes,
and stuff in the last segment,
I'm happy.
holding of something.
Correct.
Yes. So it can live, sorry.
Up to 8 hours on copper. It can last days on stainless steel and plastic. It can live 24 hours on a cardboard box. So hand hygiene. That is why I hear people say, well, we want to hear about other ways to stay safe other than this hand washing. Well, hand washing and hand hygiene. Wash your hands properly and don't touch your face. That's very, very important to keep yourself healthy.
Along those lines, a lot of stores are out of hand sanitizers. People just can't find it. And disinfectant sprays. What alternatives are there in keeping safe? You talk about surfaces. What other alternatives alternative measures can we use to try and keep safe and keep surfaces clean?
When you wash your hands, soap and water works a little better than alcohol-based hand sanitizer. So if you could use soap and water, 20 seconds, front and back surface of the hands, perfect. Now, as it relates to cleaning household surfaces, you don't need anything fancy. Bleach and water is fine. You dilute the bleach, that's household bleach, at least 95% and above, 1 part bleach and 9 parts water. You can clean your surfaces with that, that'll work.
Another online question, will a flu shot increase or decrease my risk of getting coronavirus?
It won't do either, but you should get a flu shot because the flu also kills plenty of people per year. I think it's 30,000 in the United States annually, and that's just good protection and prevention.
What about taking vitamin C supplements? A lot of people have been taking vitamin C and trying. Does that help in any way?
Staying healthy will help, and making sure your immune system is strong. That includes eating well, taking multivitamins if you don't eat well, resting, staying hydrated, and then stay away from sick people.
Yeah, general good, good healthy practices. What about those people who are predisposed to certain conditions? I know you've talked about this before, but we are a society that has a lot of cases, diabetes, hypertension, things like that. Who are the people who are most at risk? And again, what should they be doing?
So persons who have medical problems like diabetes, high blood pressure, lung disease, cerebral palsy, sickle cell anemia, if you're on certain medications that will weaken your immune system, like high-dose steroids, if you're getting chemotherapy, those are certainly some conditions that can put you at risk, definitely if you have a lung problem. What do you do?
Lung problem, mean like asthma?
Oh yeah, if you have lung damage, if you have abnormal lungs.
What about smokers?
Smokers, yes, because I would think that would make your lung physiology different. Well, this is what you have to do. You more than anybody else, you have to stay away from other people. Stay home. Don't have visitors and try to limit your movements in and outside your house. You really should.
Good advice. When we come back, our final segment, we're going to do something a little different in this segment, give you some practical advice and show you how to do something very, very important. Stay with us. On the Record continues. Our final segment is up right after this break. Welcome to On the Record.
Looking for more On the Record? If you miss our Thursday showing at 8 p.m., join us for the re-airing on Friday mornings at 10, and then again each Sunday night at 8:30. Or go to our YouTube channel and catch up on all of our past episodes. And then like our Facebook and Instagram pages for a preview of upcoming shows and get a chance to ask your questions. Just look for On the Record.
And we are back. This is our final segment in On the Record. Dr. Nikkiah Forbes is my guest. We're doing something a little different tonight just because the circumstances make it necessary. I want to talk about some of the protective things, protective gear that people can use and possibly will have to use as we prepare for a surge and even having to deal with people. So I want to talk first about gloves and in what circumstances should people be wearing gloves? How should we wear them? And more importantly, how should we take them off?
Yes, so let me first start by saying that gloves are equipment that we use if we're caring for somebody who's known to have COVID-19.
So I don't need to be standing outside opening doors with gloves on.
And we don't need to be using them as we go about our usual everyday movements.
Sure.
Only if you're caring for somebody.
Okay, so if you happen to be caring for someone, let's say somebody is in quarantine or you're just not sure at this point and you want to take some precautions, you say, okay, let me get some gloves. How should we properly utilize these gloves?
So I'm going to show you how to put them on if you're caring for somebody who is suspected or confirmed. And healthcare workers are trained to do this.
Sure.
So they can work one left hand, right hand. There is no special hand in these kinds of gloves. So you can just slip them on over your hands. And you want to pull the cuff up as far as possible. And same thing on the other side. Right?
Tell them all.
And you should take off all your jewelry, like watches and so on.
Okay, so
That's
I should have
important.
not left the ring on.
And you should have washed your hands beforehand.
Okay, I put them on backwards too. Okay, go ahead.
Got it? And then pull the cuff up as far as possible, and then you would not have had that watch on.
Right. So
if you were taking care of someone.
Okay,
right.
great.
Okay, so then you can safely provide care if you had a loved one at home, say a child, or you needed to help them, if you needed to do hygiene for them, then you are protected with your gloves. And now when we think about taking them off, your thumb should be upward, because what you're trying to do is you're trying not to get the surface of these gloves that are now dirty, you're trying not to get the virus on your skin. That's the idea, right? So your thumb should be upward, and then you're going to pinch up here by your wrist and pull downward, right, over your closed hands. You see I turned it inside out, right? So therefore, all the germs are inside. Then I'm going to put it in my other hands and close my hands to reduce the spread of germs. Now, my hand is clean because I washed my hand properly beforehand. So now see under my cuff, that's why it's also important to pull it up all the way, because now there's a space between my skin and this glove.
Okay.
I'm going to slip a finger. A lot of people use their index finger in and turn the gloves inside out so that I don't have contact with the dirty side of the glove. That's how healthcare workers, that's how we take these gloves off when we're seeing and giving care to such patients. And then you throw it in the bin, and then you wash your hands or use alcohol-based hand sanitizer.
Immediately afterwards.
Yes.
Okay. All right. So let's go through. We'll just drop these on the floor.
Yes, let's pretend it's a bin.
Yeah, there you go. Okay. So a big thing for people now are masks. We see a lot of people walking around with masks, asking a lot of questions. We've got several types here. I just want to sort of display what they are and how they work. These are two that I have.
Okay.
And you can just sort of tell me the difference in them and who would wear them and how.
So this is called a droplet mask. And this is for people who are sick with flu-like symptoms, cough, runny nose, fever. We put this on the patient to stop the spread of droplets into the environment. So I know you wanted to demonstrate, but shall I demonstrate for you?
Sure, please.
Okay.
Please.
So you're going to open it, and then this one has these convenient little loops. So I could put this here, then I'm going to pull it down, and then it has a metal, has a piece of metal that's malleable. What I did was I fitted over my nose bridge and my face.
You adjusted it, yeah.
And so what we do is we put that on persons who are having cough and symptoms, fever, to prevent the droplets from going on other people. This is not for people who are well. This is also for healthcare
Could you
workers.
repeat that?
This is not for people who are well. So when you're going about your regular everyday activity, you shouldn't have this mask on, because I just want to just stick a pin and say these equipment, they're specialized, and they also help healthcare workers safely provide care to patients who are confirmed or suspected of having COVID-19 and other problems. If you are using this in your day-to-day activities, thinking that you're keeping yourself safer, you're really not, because air leaks around here in the general environment. They get wet with our water vapor in our airways after about 20 minutes. They can get dirty. They're also very hot and uncomfortable. When you put yours on later, they're itchy. You're more likely to adjust them and touch your face, which now increases your chance that you're gonna get sick. So it's quite ironic that you think you're protecting yourself, but you really may not be. Unless you're coming into close contact with a person who's confirmed or suspected, you really don't need this. The gloves too, also remember the virus can be on those gloves for hours, and then you're touching surfaces and yourself. So that's why we don't recommend
This is a similar type of glove, mask, only difference is it ties. Okay, and this.
Yeah, okay. So this is N95 mask. We like to use masks like this, and some expert agencies recommend use of these masks in care of COVID-19 patients. It's called an N95. It filters out 95% of the air. So therefore it filters out viral particles effectively too. So it's also for providing care. This is for healthcare workers, you all, to provide care of patients who are infected. So I could demonstrate how to put it on. Healthcare workers are trained. You hold it in your hand, you put it over your face, and then you pull the straps up. One will be on the top of your head, one will be in the back. Could I just please make a plea, because there's a global shortage of these items right now. As a matter of fact, we can see in very, very rich countries, they don't have enough of these things, and healthcare workers are in great danger and jeopardy, because they have they are going to provide care, but if they're not protected, it really increases the chance that they're going to get infected. And so
we don't need to hoard these and take them home and wear them unnecessarily.
Right.
Yeah. So only if you are in quarantine, or if you are. What about if you are in quarantine? You think maybe whether through self-isolation or you are quarantined?
Quarantine is for people who are well, but they could have a risk for getting an infection. Either they traveled from someplace where there's a lot of transmission, or they've been in contact with somebody who's confirmed. They might be at risk of getting the infection, but they have no signs and symptoms. They're healthy. We're just watching them over caution. Isolation is for people who are sick, who have symptoms, who have either you suspect has COVID-19, or they're high risk, and so, or you're feeling sick, and so you're keeping yourself away from other people. So somebody could be in isolation at home. They would be in their own room with the door closed, with the windows open. So what if you are their family member and you had to provide care? You know, there could be situations, we don't recommend that. Well, then you could reduce your risk by providing care with these things.
Dr. Forbes, I just also too want to use this opportunity to say thank you to yourself, to the many healthcare workers, the doctors, the nurses, which you mentioned when we were off camera, all of those who are out there every day putting themselves at risk but providing that essential care. I want to say thank you to you and all that you represent. We owe you a great debt of gratitude. We know that we're in this for a long haul, but certainly we would not be where we are today, as well prepared as we are, if it were not for you and others like you in the community. We thank you so much for the work that you are doing and continue to do. Thank you for helping to keep us safe up to this point. And we know and we trust that when this is all over, we will look back and have an even more greater sense of gratitude for what you have done. So thank you very much, and thank you for coming on the show tonight.
My pleasure. Before I go, I just want to say a huge thank you to all those doctors and nurses, the nurses on the front line. These men and women are serving with heart. They're giving their all, and they're staying at work so that we can all benefit. So thank you. I'm really just a part of a team, all parts of the team. We're only as strong as our weakest link right now, and we're working well together in great teamwork, and everyone is willing to help. I just want to say thank you in helping us to bring the message out there.
My
and
pleasure.
Getting the facts
And that's
out
what we're
there.
here to do. Thank you so much for coming. That's going to do it for tonight's episode. As always, thanks for watching. Special thanks to my guest, Bahamian sensation, I call it, Dr. Nikkiah Forbes. Also, thank you to my technical and production team. Please remember to abide by the rules of the curfew and only leave your house for essential services. And by doing so, the life you save may be your very own. Keep up to date with all of the very latest here on RTV, and be sure and follow us on Facebook, Our News Bahamas on Facebook. Until next time, I'm your host, Jerome Sawyer. Thanks for watching.